A baby born in the breech position usually doesn't have an increased risk of having bowed legs in the future, but it can cause problems with the development of their hips. Normally, babies are born in a cephalic or head down position. There are different types of breech presentation, but essentially their head is up and their bottom is down. And when that happens, their legs may be pressed upward that stretches or puts extra pressure on their hip joints. The hip is a ball and socket joint. The head of the femur needs to sit into the hip joint. A baby who's been born breech may have an underdeveloped or flat socket, and that puts them at increased risk for hip dislocation. Now, there are several things that we will do to screen for hip dysplasia. There are several things that we will do to screen for developmental hip dysplasia, including physical exam. This illustration shows the Barlow and Ortolani physical exam maneuvers to check for hip dysplasia. You can also perform the Galeazzi maneuver, where you lie a baby on their back and then push their heels up to their bottom to make sure that their knees are parallel to each other. You could also flip them over so that they're on their stomach and then make sure that all the lines on the back of their legs are parallel to each other. Babies who are born breech, though, are at increased risk for hip dysplasia, and so it's recommended to get some imaging. We usually do ultrasound when they are around 1 month old, and then an x-ray when they are 6 months old.